So from the first moment that I had my first consultation with Dr. Fishman, I was incredibly impressed. I felt like I could have sat there for 3 hours and he would have answered or explained every single question. I had no doubt in a way that this was the right answer for me. I'm very big into alternative healing, and I just knew, I mean, whether you know it in your heart or not, I knew this was the only next step for me. And I believe that I saw him at least 2 times before we scheduled the actual deployment date. And honestly, my experience in the surgery center is very simple. I went in, I got drugged, I came home, and I anticipated a lot of pain. I was put out for my procedure because to inject into the ankles would have been extremely painful. I took 1 hydrocodone that night thinking I might have more pain, and I never took another one. I did use CBD, and I do think in respect to the procedure, you just have to be quiet. You have to kind of do the least amount for a while during your day, and for me it meant just coming home and sitting and letting the little stem cells do their work. We also used for that procedure Wharton's jelly, that because of my age, I'm 68, Dr. Fishman felt that fresh from an umbilical cord would be more vibrant and more sparkly than my aged ones, and so I didn't have lipo done or stem cell extraction done. And I also, of course, had the infusion at the same time. And I will say that over the first few months, I did take on occasion some CBD. Again, I would do it maybe at the end of my day when I came home, take it, and then just sit with in my case, with my feet up.